What's one of the worst financial investments you have made? When you take into consideration the years of training, the six-figure debt, let alone the mental stress it takes to become a doctor, any financial advisor would tell you it's a bad investment for the return. But ultimately, I didn't care. I was called by God to be a healer, and I listened to the call. Simply put, I became a doctor to keep my father, who has a history of cancer and diabetes, healthy. I became a naturopathic doctor, or a doctor that uses more natural treatments before drugs and surgery, to help my patients truly heal and just to be more fulfilled in my craft. We named ourselves Medlink Health Solutions because we sought to link the patient with the doctor directly. Because there is no compassion in medicine anymore. Having compassion decreases your bottom line. We are told there's a balance between the science of medicine and the art of medicine. The science part is easy, the art is difficult. I wanted a system that gave me whatever it took to treat a patient in the most natural, empowering, and sustainable way. Because your first resort should not be to take medication for the rest of your life or to have a permanently life-altering surgery. There is a better way. At Medlink, we offer you a doctor experience like you've never had. We give you time, compassion, a listening ear. We give you the comfort that comes with talking to a friend or family member in your own environment, not an exhausted, rushed doctor in a white-walled clinic or hospital. We meet you where you're at. We make it the most convenient for you as the patient. Not what's the most convenient for us. Most of the time, your diagnosis does not matter. You are what matters, and how you live your life is creating that diagnosis. I achieve results by simply just listening to my patients, because guess what? You usually know what's wrong. With my training in nutrition, herbals, supplements, physical medicine, acupuncture, mental, emotional, and pharmaceutical medicine, I can help you achieve health in the least invasive ways. You know what fulfills me the most in medicine? Helping patients heal physically from joint pain and avoid surgery. We are not designed in chaos, but rather we are intelligently put together, and our bodies can do incredible things when given the right building blocks. When conventional medicine treats joint pain, it often comes along with surgery or simply masking the pain. But nobody really talks about reversing and healing pain. That's what I do. I use your body's healing process to target pain inside joints with injections. I use liquid allograft, or your own blood called PRP or platelet-rich plasma, to kickstart the healing process where it's needed. Whether joint pain is from osteoarthritis, injury, or misuse over the decades, you can heal. And these are the list of the conditions that I typically treat. I get a positive result in about 100% of my patients, and often I see an 80 to 90% improvement in just one injection alone. It's not just about joint pain for me though, because I see you as a whole person. Joint pain may get you in my door, but you leave with the start of a healing reaction and information about diet, sleep, exercise, supplements like turmeric, chondrosamine, CBD, and its therapeutic amount. These things are just as important as the injections I perform. After I heal your joint pain, I can take you on for your other issues such as diabetes, high blood pressure, anxiety, or even menopausal symptoms. I was called to heal others by God, and for as long as I will live, I will answer that call. Just today, a patient who received a regenerative joint injection for her chronic pain told me, "You must love your job. You actually heal people." And I really do. What could you do if you were healthier and pain-free? Where would you go if you were free of your label called your diagnosis? How would you like to enjoy your life rather than bear it? It's time to live your new life pain-free.